Good evening, everyone. Before we start this session, we would like to start this with a land acknowledgement. We respect the spirit. Sorry, one. We acknowledge we are gathered on Treaty 1 territory and that Manitoba is located on the treaty territories and ancestral land of the Anishinaabe, Anishinaabe, the Cote Oyate, the Nesuline, and Nehetuok nations. We acknowledge Manitoba is located on the homeland territories of the Red River Métis. We also preventing changing your lifestyle to prevent diseases from happening. So it is really my honor to welcome all of you and to bring greetings from on behalf of Cancer Care Manitoba. And I will pass off the floor to Leslie to start off the discussion.
Thank you, Ken. Hello, everybody. My name is Leslie Baldry. I am a health educator here at Cancer Care Manitoba, and I'm going to talk to you today about cancer screening and prevention. So before we get started, I want to just throw up a poll onto the screen. And the question I want to ask you is, have you heard of cancer? So all you need to do is punch in. And for some reason, the polls are not showing. Oh, here we go, launch. So have you heard of cancer before? So just click yes for yes and no for no. And, or if you're not sure, that's okay too, just put not sure. Part of this is just making sure the technology is working and also for me to get a sense of where you're at as an audience. So let's give you a few more seconds. Oh, we've got everybody already. Oh, not yet. Coming through. Okay, that's great. Okay, so that gives me a good sense of where everybody's at. So thank you for doing that. I am just going to proceed to the next slide. So I'm going to talk a little bit about cancer, and just to give those of you a sense who aren't as sure of what cancer is, and Alison Ween's going to talk a little bit more about it afterwards, but it's an illness that can make you sick, can make you very sick, and some people actually die from cancer, unfortunately. So the reason I'm here today is to give you some things you can do to help keep yourself safe and to help prevent you from getting cancer in the first place. So we're going to talk about cancer of 3 different areas in the body. Cancer can grow anywhere in your body, but we're going to talk about 3 different areas specifically. So the first ones we're going to talk, well, not in this order, but we're going to talk about breast cancer and how to prevent it. We're going to talk about cervical cancer, how to prevent it, and colon cancer and how to prevent it, as well as how to screen for all these cancers before any symptoms come about. Okay, so if you have questions, you can type them into the chat box, I believe, and we have someone who's going to be monitoring those, and we'll take those questions at the end. But if you don't want to lose track, just feel free to pop it in there. So let's start off by talking about what is cancer screening. And really, it's a test that's done to help find an early cancer or to stop cancer from starting in the first place. Remember, cancer is a sickness that can make you very sick, and some people die from it, unfortunately. And for cancer screening to work the best, it is essentially for people who have no symptoms. Okay, so a symptom is, for example, you know, when you feel sick, or you've got a lump in your breast, or signs and symptoms really, but basically something that you don't see or feel in your body, you feel totally fine. We're trying to target people who feel healthy and who feel fine and have no health issues related to these particular disease sites or these cancer areas. Okay, so normally you go to the doctor or you get a medical test done when you feel sick, but it's actually different with cancer screening. It's something that you do when you feel okay, when you feel fine. So we're going to talk about 3 different areas today. We're going to start off with cervix check. So I'll just show you first of all where your cervix is if you have one. Not everybody has one. Typically females have them, and some trans, gender diverse and non-binary folks also have cervixes. So the cervix is right here at the bottom of the uterus. And the uterus is the part of the body that opens or not the uterus, well, it does open, but the cervix dilates to 10 centimeters when a woman gives birth to a baby through her vagina. Okay, so that's the part of the body that we're talking about. And you can't really see your cervix yourself because it's up inside of your body. So that's why we need a little help to figure out if there's something going on. So like the other areas I talked about, cancer can grow in the cervix and it can be a mass. It can be cells that are going into the different tissues and spreading through the body. So this is what we're actually looking for, or we're looking for the signs that would come before a cervical cancer would even actually start. So for cervix check, we recommend that most people who have a cervix and are between the ages of 21 and 69, we recommend that they have a pap test every 3 years. And this isn't necessarily for anyone who has a cervix age 21 to 69. It's for anyone who's had sexual contact. And we're going to talk a little bit about what sexual contact means. But I'm just going to repeat this one more time. So we recommend that most people age 21 to 69 who have a cervix. So remember that cervix is this bottom part right here, bottom part of the uterus. If you have one of those and you're age 21 to 69 and you've had sexual contact, you should have a pap test every 3 years. Okay, so every 3 years. So when we're talking about sexual contact, this is important. We're talking about skin-to-skin contact between two people of the oral area, the genital area here, as you can see, or the anal area. And it doesn't matter if your partner is male or female or non-binary, or it doesn't matter who the partner is. If there's any skin-to-skin contact between those parts of the body, there's a virus called HPV that can pass from person to person. And that's how that happens, okay? And HPV can cause cancer. So that's why if you've had sexual contact and you are between the ages of 21 and 69, you should have a pap test every 3 years, okay? So how it works here in Manitoba is when you turn 21, you become eligible. You can get a pap test if you've ever had that sexual contact. Cervix Check, which is part of Cancer Care Manitoba, will send you a letter in the mail. So this is what the letter looks like. Someone's reading the letter. And now this letter basically says, you know, we know that you're now eligible for screening. We encourage you to call to make an appointment. So that's what this person's doing here, okay? And she's making an appointment with a healthcare provider. So that can be a doctor, it can be a nurse, it can be a nurse practitioner. There's many types of healthcare providers that can do a pap test for you. So you just call to make the appointment. And you need to have a Manitoba health card in order to be screened for any of our cancers, okay, through our programs. So make sure you have your Manitoba health card with you when you call on the phone and when you go in for the actual appointment. So when you go in for the appointment, you will be asked to undress. So you'll take off your clothes from the waist down and you'll sit on an exam table like this and you'll put your feet up in footrests. Okay, so your feet will just rest there and you'll have a drape over top of your legs and it's all private. It's in a room where there's the door is closed. It's just you and the healthcare provider. Okay. And the healthcare provider will do the pap test. So I'm going to explain to you what happens during the pap test. So basically, what's called a speculum. So this is what a speculum looks like, and it's inserted into the vagina. So here you can see in the picture here, here's the speculum, it's inserted into the vagina and then opens up around the cervix like this. And this is what it looks like on the inside. That's what the healthcare provider will see. Sorry, it's hard to do this backwards. Will look like that. That's the os, the opening. And then the healthcare provider will insert a broom. So it's really soft, it doesn't hurt. They'll insert it into the os of the cervix. They'll rotate it 5 times, take it out, and then they'll send this specimen to the lab to check for abnormal cells. So we're looking for those abnormal cells that could go into cancer, okay? And the pap test shouldn't hurt. It shouldn't be uncomfortable. Or it might be a little uncomfortable, but it shouldn't be painful. If it hurts, make sure you tell the healthcare provider to stop and you let them know that it hurts, okay? And they can maybe readjust, or you'll have to figure out the next steps together. But it shouldn't be painful, okay? It might be a bit uncomfortable. So the results of a pap test are normal or abnormal. Those are the two options. So if the result is normal, it means they didn't find any problem cells, and you will be invited to have another pap test in 3 years. Okay. If the result is abnormal, meaning there's a problem, then you'll be invited to come for another pap test in 6 months, or you'll go to colposcopy. That's what this is here, colposcopy. It's another appointment, and it's very similar to a pap test, except that there's a microscope kind of the machine, or not a microscope really, but it's a magnifying scope, and it magnifies the cervix so that the healthcare provider can see what's going on, if there's anything they need to treat or do any other kind of test, okay? So true or false, there is a vaccine that can help prevent cancer of the cervix. True or false? And if you're not sure, that's okay too. Just hit not sure. Okay. It's good smattering there. Okay, good job. All right, so this is how people voted. So the answer is actually true. There is a vaccine that can help prevent cervical cancer. It's amazing. So this vaccine is something that is offered in, oh, sorry, I didn't put it on that slide. That's offered in the grade 6 school system. Oh, I have that on the next one. So that if you have children in grade 6, they will be offered the vaccine through the school. So the public health nurse will come to the school, she'll vaccinate the first time, and then she'll come back 6 months later and she'll vaccinate all those kids again. So to help stop you from getting cancer of the cervix, Cervix Check recommends that you get screened with a pap test every 3 years and consider getting vaccinated against HPV. And that's something that you can talk to your doctor about, or your nurse practitioner, if you have a nurse practitioner, or if you have a community health nurse, you can just talk to your healthcare provider if you have questions about it. The vaccine is offered in grade 6 to girls and boys, and that's something that a note will come home, and then if you consent or if you agree, then that's when the public health nurse comes to school. You have to sign off on that form and then send it back with your kid to school. Okay. If you need a place to go for a pap test, we have a website. So this is where it is here, cancercare.nb.ca/screening. And you just click on this blue button right here, and you can either go to your regular healthcare provider, or you can find a pap test clinic in your area. You just punch in the postal code, hit search, and then a listing of all the pap test clinics closest to you will come up, and then you can call and make an appointment for a pap test if you don't have a regular healthcare provider. Okay. Okay. Colon check. So I'm going to talk about colon check. So this is a different part of the body. The colon is right here. And this is the part of the body that helps to get rid of the stuff in your body you don't need. So when you eat a meal, it goes through your body and your body takes out of the food what it needs, and then the rest goes into poop. And that's what comes out of your rectum here. Okay. So that's the part of body that we're talking about, the colon. And again, it's not something you can see. You can't see inside your colon just from the outside of your body. So we do a test to figure out if there's something that we need to look into further. So cancer can grow in the colon just like it can grow in the cervix. So this is sort of what it looks or what it can look like here. So as the poop comes through the colon, if there is any kind of polyps in the colon, it bleeds sometimes a little bit, and then sometimes it doesn't, and then it bleeds sometimes. So it just it kind of bleeds intermittently or every once in a while. So, and it's a very small amount of blood, which is in the stool, but you won't be able to see it when the stool goes into the toilet when you poop it out. Okay. So, question for you, true or false, you can do the colon cancer screening test at home. True, false, or you're not sure. You can do the colon cancer screening test at home. What do you think? Okay, looking good. All right, so I'll just share. This is what people are thinking. So most of you said true, some of you said false, and some of you said not sure. That's all fair. So the answer is actually true. You can do the test to screen for colon cancer at home. I just think that's such a cool thing. So let's talk about it. So this is what the test looks like. It's called a colon cancer screening test. And most people, so men, women, everybody, can do the test between the ages of 50 and 74. And we recommend every 2 years to do this test, okay? And this test is also sometimes called an FOBT. So an F stands for fecal or stool. Occult stands for hidden. B stands for blood. T stands for test. So it's called an FOBT. If we were in a classroom, we'd all say it together right now. So it's a test that you can do at home. And this test actually can look 2 different ways. This is one way that it can look. This is one type of FOBT, and this is another kind of FOBT. They both do the same thing, just a little bit differently. Most people in Manitoba are getting this test right now. Some people are getting this test, and it depends on your risk factors. So if you have people in your family who have had colorectal cancer, then you probably would get a test that looks like this if it's far enough, if there's lots of different factors, but that is one of the ways that people may get a different type of test. It depends on their history and what's going on. So this test looks for that the hidden blood in the stool. So these polyps, they cause a little bit of blood to come out into the poop, and that's what this test is looking for. So this is a test you can do at home, and it's a very simple test to do. So there's a video on our website that has all of the information on how to do the test, and you have to collect a sample from your stool 3 times within 7 days, so within a week. You collect a bit of stool and you put it on the card, then you collect from a different part of the stool and you put it on the card, and then you send it in the mail to the lab. Okay, so there's instruction videos on our website. So if you get this kit in the mail, you can look on our website, and we have lots of good information on there in terms of how to do the kit. And the other piece that you should know too, I'm just going to show you what it looks like. This is what the website looks like. So the instructions are here, and we have the test in other languages as well. So if that's something that you're needing, we can share those other languages with you so that you can read the instructions a little more easily. So again, 3 times within 7 days. So if I pooped on Sunday, I take a sample. If I poop on Monday, I take a sample. I didn't on Tuesday, but then I do on Wednesday, then you take a sample. And then that's when you mail it in after those 3 times, okay? So there's different types of results, normal or abnormal. If the result is normal, then you'll get another kit in the mail. We'll send you another kit in 3 years, okay? If the result is abnormal, then we would send you for a different kind of test. It's called a colonoscopy. And it's a test that you cannot do at home. You'd have to go into the hospital to have this test done. But we will give you all the instructions and we'll talk with you and prepare you if that's something that happens, okay? So you will get a kit in the mail, but if you are between the ages of 50 and 74 and you have not gotten a kit in the mail, you can request a kit. And you can do that by mail, or sorry, not by mail. We'll send you a letter in the mail, but you can request it online on our website. So right on this page here, this is where you can request it. So there's a request form right at the bottom of the page, and you fill out all of this information, and then we will send you the kit in the mail. And then you can do the test at home. Or you can call us and we'll give you a test if you're eligible. We'll send it to you in the mail. Okay, so here's just what I showed you. So you go to this website here and you click on request a test, and then this form will come up and you can just punch in your information and then we'll send it to you in the mail. Okay, that's what it looks like. All right, let's talk about breast check. We do have some questions, but I'm not going to take those right now. We'll take them at the end, but we will address them. Don't worry. So breast check. So breast cancer. So cancer can grow in the breast, just like it can grow in the colon, just like it can grow in the cervix. Okay. And if cancer keeps growing and growing, then it interrupts how the body works, and the body's not going to work properly. It can make you very sick. Okay. So what we recommend at Breast Check is most women aged 50 to 74 have a screening mammogram every 2 years. So we're finding early breast cancer. So if someone has a lump in their breast, then we would not screen them at Breast Check, but they do need to talk to their healthcare provider. And we say women here, but it's also trans folks who fit certain criteria, gender diverse and non-binary individuals as well. Okay, so if you fit that criteria, that we have information for you that will let you know when you need to be screened. Okay, so a screening mammogram is essentially, it's called a breast x-ray, and it compresses the breast. Okay, so true or false, compression, so essentially a squishing of the breast, is needed to get a clear image of the breast tissue. True or false, or you're not sure? So men have breast tissue too, but they don't get screening mammograms, okay? Breast cancer is much more common in women. Okay, so this is what most people voted here. Most people voted true. So that's good. So yeah, the answer is true. Compression is definitely needed to get a clear image of the breast. So I'm just going to show you something on my desk. So this is like what breast tissue can look like when it's not compressed or squished. Okay. And you can't really see all of the tissue. All you can see is just what's here on this side. Okay. But if I take this here, oh, sorry, yes, and it's very hard to do backwards. So here you can see the breast tissue, but then if I spread this out, now you can see much more of the tissue. There's a lot more there. And in fact, if you look really closely, you can see that there's a blue marble here. It's a little hard to tell because my background's blue, but that's the blue marble there. That's actually a cancer. And I can only see that because we've compressed, or we've spread out all of the breast tissue. This is not really what breast tissue looks like. That doesn't look like marbles, but it just gives you a sense that you can actually see more when it's all spread out, as opposed to if I just do it like this, then you can't see half of what's in there. Okay. So that's just how I like to explain breast compression. And it is necessary. It's not harmful to the breast. It might feel like a lot of pressure when the paddle's coming down, but it helps to get a really clear picture of the tissue in the breast. And it also reduces or lessens the amount of radiation that we use to get the image. And most clients say that it's uncomfortable, but I can handle it. It's tolerable. It's okay. Okay. So to make a screening mammogram appointment, we'll send you a letter in the mail saying, hey, it's time for you to have a screening mammogram. We invite you to make an appointment. So you will call Breast Check on the phone, usually when you turn 50, and you can make the appointment. And at that time, if you have any mobility issues or you need an interpreter, you can ask for that and we'll make sure you have what you need for your appointment. Okay, all of those things can be supported here at Breast Check. So on the day of your appointment, you're going to want to make sure that you wear a top and a bottom. You don't want to wear a dress, one-piece outfit. You want to wear two pieces because you need to remove your top part for the mammogram. Okay, so two-piece outfit. So don't wear a dress, don't wear a one-piece outfit. You want to make sure you have two pieces. Otherwise, you have to take your whole dress off for the mammogram. Okay. Also, on the day of the appointment for your mammogram, don't put any deodorant on underneath your armpits. You don't want to use any lotion and no powder in your whole breast area or under your armpits. Don't want to put it anywhere in there because it will help. It will make it harder to read the mammogram. So when you come in, you want to check in at the front desk. Make sure you have your Manitoba health card with you on the day of your appointment. Okay. And you'll be asked to undress from the waist up. So you'll have to take off your bra if you're wearing one, or a blouse or a shirt, you need to take that off. And if you need an interpreter, that as long as you mention it when you make the appointment initially. So right here, when you call in to make the appointment, you need to mention that you need an interpreter. And then on the day of the appointment, we make sure that interpreter is there for you. Then the actual mammogram will happen. There is compression of the breast this way and then this way on both sides. So there's 4 pictures taken all together. The results are normal, in which case you will be asked to come back for another mammogram in 2 years, or abnormal, in which case you will be sent for other testing. So it can be an ultrasound, you can have another type of mammogram called a diagnostic mammogram. It's very similar to a screening mammogram, and they may take a biopsy using a needle to get some tissue out of the breast to see what's going on. Okay. We also have some resources that I think there's some facilitators on this call today. We have some resources that use a lot of the same illustrations that I just showed you, and it's available in English and in French for cervix check and breast check. We're not quite done the colon check one yet, but we do have those 2 there that you're welcome to order. The other thing I want to just show you really quickly is we have a website called Practice Prevention, and this is what it looks like here. So you just go to Practice Prevention and you can read up on how to prevent cancer. So how to eat healthy, how to move more, how to maintain a healthy weight, live smoke-free, avoid alcohol, and so on. So you can access that. If you're not sure on if you should get screened for cancer or not get screened, you can do what's called a decision aid. So you just click on that and then you answer these questions. And if you need help answering them, you can ask a friend, or we can help walk you through it here at the program too. So you put in your age, how tall you are, how much you weigh, and then you go through all of these different categories. So daily living, so we ask about if you smoke, that kind of stuff. We ask about some history for breast cancer, for cervix cancer. We ask some questions about sexual contact and when you had your last PAP, and colon. And then when you're done, you hit finish, and it'll give you a whole list of recommendations that will help you know whether you need to be screened or not at this time. Okay, so that's a resource that we like you to know about. It's practiceprevention.ca, and you can also get to it by going to the cancercare.nb.ca screening. Okay. Oh, sorry, there it is, a little snapshot for you. All right, so another question for you, true or false? I know where to go for more information about cancer screening. So do you know where to go for more information if you have questions about cancer screening? True or false, or you're not sure? Okay. Most of you know where to go, so that's good. So 81% of you know where to go for more information. So for those of you who weren't so sure, I'm just going to point it out again. So cancercare.mb.ca/screening is where you can go for more information. And this is what the homepage looks like here. So you just put in cancercare.mb.ca/screening. You don't need this info part. It'll just automatically come up. But this is where you can go for more information. Okay. Just having now trouble being able to move this. There we go. Oh, we've got 2 in there. Okay. All right, so there's the URL in case you weren't sure. And I don't believe we're taking questions just yet. So I am going to pass this off to Allison Weens.
Thank you so much, Leslie. I really appreciate that. I am hoping that everyone can get some benefit from listening to my talk. I'm just going to get my screen sharing done here. Sorry about this. Okay, are we able to see this when I go into the screen? If Melanie, if you want to give me a thumbs up or something, that would be great. It'd be great to see everyone, but that's just not the way we can use technology. So
yes, we can see the screen.
Amazing. So I'm not nearly as tech savvy as the wonderful Leslie. So there won't be any pop quizzes, but hopefully that sets folks at ease a bit, and you can enjoy and engage in what I am going to share with you. So I'm really going to focus in about what we do when we don't screen for cancer. This question comes up a lot. My name again is Allison Weens, and I work as an education and liaison nurse with the Underserved Populations Program, and I've been a cancer nurse since about 2008 in different roles and different nursing jobs. And this question comes up around, why don't I get screened, or why am I not supposed to be screened? So we're going to go through that question, and also when to seek medical advice. So the only kind of tech thing that I've done is add a little bit of an image here for folks to look at. So this fellow here is pondering, should I be seeing a healthcare provider? When is the time to see a healthcare provider? And this is a really important question because, again, as Leslie had discussed, screening for cancer is for when people have no symptoms and who meet the screening guidelines. And that's really key too. We have screening guidelines, and you would have heard Leslie talk about the age ranges. That's really important for ensuring that we are getting the most benefit of potentially catching early disease without increasing folks' risk or potential for harm. So when you're outside of that age range, or when symptoms happen, are when people need to consider seeking medical advice. So again, we need to seek medical advice when symptoms are present, or when there's concerns that exist outside of the screening age groups. So example, for cervical screening, Leslie had talked about the ages of 21 to 69. So we're talking about folks younger than that age group and older than that age group. And we want to make sure that folks are seeking care when it's appropriate. So what do you do if you have a symptom? What should someone do if they have a symptom? I've put a couple of options here for seeking medical advice or seeking medical care through doctors or nurse practitioners for newcomers. So specifically for folks who may not yet have a family doctor, there are programs through Mount Carmel Clinic. There's a specific newcomer program, also through Bridge Care for initial care for refugees. And also there's some amazing education programs about learning about the healthcare system and what Manitoba healthcare looks like and how it works. And then of course there's Family Doctor Finder. And Melanie, if you can pop in Family Doctor Finder to the chat, that would be great, because this is definitely something that I would recommend for everybody. One of the major things that can determine somebody's health outcomes, so how healthy they can be, is their access to a primary care provider. So this is people who have nurse practitioners or family doctors that they see regularly or can see regularly or can see when something comes up. Also, I've listed here that urgent care and emergency care is also important when necessary. There's also information here about getting registered through Manitoba Health. So folks need to be residents for 3 months to start getting Manitoba Health coverage, but application should be looked into as soon as possible. And this is likely not new information, but it's certainly important that folks are looking into healthcare coverage as soon as they are residing in Manitoba. And that hopefully they have something to bridge healthcare coverage for that 3-month waiting period before Manitoba Health coverage. So Leslie had talked about me giving you a brief overview about what is cancer, and I'm going to try and do this quickly. So there's over 100 types of cancers. This isn't one thing. There's cancers that can be in the breast, lung, cervix, in the brain, in the skin tissue, in the muscle tissue, in the blood, or bone marrow. And so there are so many different types of cancer, and it's important to recognize that cancer exists in many different ways. So I want to talk a little bit though about what is cancer. Cancer starts in a single cell. And cells are the basic units that make up all parts of our body. So an example is a skin cell, a nail cell, a hair cell, the cells that make up the follicles of our hair, the mucus cells. This is the cells inside the lining of our lips. There's cells that make up all parts of our body. And cancer is a disease where cells change and make errors. So they make mistakes, and where they start to grow uncontrollably, or they start to grow more than they should, and they don't do what they normally do. So normal cells will grow, they'll work, they'll do their jobs. Let's say an immune cell, or a cell that's supposed to help you fight an infection. Cells will divide. It's normal for them to continue to divide. They'll repair when they're damaged, and eventually they'll die. All the cells in our body are programmed to die at a certain point, and we continue to replace those cells in certain time frames. Cells get damaged, as I said, all the time. It's super normal for cells to get damaged. Let's think about scraping our knee, about burning our fingertips, about sunburn, about having a cold and having sore throats, and maybe even tender tissue in our throat where there's bleeding and open areas. Our body will normally attempt to repair this, and usually we can repair it. If our body can't repair the cells that have been damaged, most of the time, the body can remove them from our body. They can get rid of them and they can kill them, or they'll tell those cells to die when they're not doing what they're supposed to do. But if these cells that aren't doing what they're supposed to do aren't removed and they aren't killed or they aren't told to die, the cells can continue to grow and divide, and eventually they can grow into a mass or a lump. If that lump is made out of certain types of cells where they've changed quite a bit or a lot, that's when we see cancerous cells, or what we call malignant cells. And we sometimes see growth where they aren't malignant or diseased cells, but they're harmless growths. So we see these, we might get lumps or bumps that are very harmless, but sometimes they're not. And this is where we really need to know, is this harmless or not? In blood cancers, what happens is blood cells and bone marrow make errors, and then we see those cells of the blood and the products of our bone marrow, or the things that are made for our blood and blood products, we see those things not doing what they're supposed to do. And so we might have more cells than we're supposed to, or less cells than we're supposed to, or diseased cells. And it's important to know that some cancers grow quickly and some cancers grow slowly. So this is more common. We see cancers that grow, it's common that cancers will grow over many, many years. And an example, that I often remember from when I first started learning about cancer is that some people who have certain types of cancer that grow slow will end up dying of things other than their cancer. And that cancer may never actually be seen or found until after death. So what are some of these symptoms? When do you need to consider going to seek medical care? And I just want to make sure this isn't a full list. This is a partial list, but it gets a sense of when we're talking about those things happening, where cancer might start growing, where things are happening and the way they're not happening the way they're supposed to. We really need to seek medical care and be seen by a physician or nurse practitioner. So this is those lumps and bumps, a new lump or bump that's changing or growing. Pain or discomfort that can't be explained or is worsening. So tummy pain, breast pain, rectal pain, that's the bum. Perineal pain, so that can be from the bum, vagina, and towards, or the penis, testicles, and the whole undercarriage. Also, other areas of pain that isn't explained. Somebody's, their leg that they haven't injured but continues to hurt, or the pain worsens, or they start to develop a lump on their leg. Also, unexplained weight loss, that can be a concern. Blood in poop, we just talked about that with Leslie. This is a concern. If we visibly see blood in poop, this is different than getting screened for people who have no symptoms. This is now a symptom. If we can see the blood in the poop, it's not that hidden blood. We need to do more testing and investigation. Other examples are a cough that won't go away, let's say after a couple of weeks or a few weeks, and it's been, the cold symptoms are gone away, or there was no connection to a cold or a flu. Also changing lesions. So these are marks or moles. Lesions are other words for, marks or moles. When we see these changing, it could be concerning for a skin cancer. Or wounds that won't heal. So cuts, scrapes, bruises that won't heal. And night sweats or fevers that are continuous. Diagnosing or finding cancer is done in different ways, through lots of different techniques, or we do different things to make a diagnosis. But number one, seeing a healthcare provider is important. They'll do a history and physical. So this is a full assessment when you go into a doctor or nurse practitioner and they're asking all those questions about, have you ever had surgery? history do you have of any other diseases? What's your family history of disease? This is all part of that history and physical. They listen to your lungs, look in your throat, look in your ears, and so on. They want to look at you from tip to tail. They'll also order some tests potentially. So that could be blood work, diagnostic imaging, which might be scans or x-rays, and something we call visualization. So this is actually looking at it. That might be done through surgery or endoscopy. So this is scopes, the cameras that go through the mouth or through the bum or into the bladder. And I want to make a special note here that in blood work, people ask questions a lot about tumor markers, but these tumor markers are only done some of the time. These are only done in certain cases where we can reliably know that a tumor marker actually can tell us something important. For most things, we aren't able to find cancer through blood work. And ultimately, a biopsy is necessary. This is where a piece of the tissue or a piece of the cells is taken so that we know exactly what it is before any treatment can be done. What happens if you might be told you have cancer? I want folks to know that there's resources here in Manitoba. Every Manitoban has access to an expert cancer navigation team that can guide patients through the cancer journey. And this team is made up of nurse navigators, cancer nurse navigators. They may have support from family physicians in oncology and psychosocial oncology clinicians or social workers and counselors. Navigation services can help patients who need support in getting through that diagnostic journey, also helping people connect to the right services and supports in the community or within Cancer Care Manitoba. And they'll work with the primary care provider in making sure those tests are actually ordered, and they can explain those tests to patients after they've reviewed them with their primary care provider to help answer any additional questions. Cancer Navigation Services is to support folks from that first suspicion of you might have cancer until treatment is established. This is the numbers for the Cancer Navigation Services across the province, and it's important to know that they're across the whole province. So, and anyone seeking care at Cancer Care Manitoba, or who is told they might have cancer, who would seek care at Cancer Care Manitoba, can access a cancer nurse navigator and navigation services. This is my information, and I, as the education and liaison nurse, can help if there's barriers to care. So if there's something that's in the way to getting care, and I can assist patients and families and providers to figure out a way to find support or to address the barrier to care that exists. I just want folks to know that we have counseling services, practical supports with social work, and peer supports through our patient and family support program. And there's also specialty nurse educators who work with patients around breast and gynae cancers to provide information and resources and support referrals to special programs for women and people who are diagnosed with breast and gynecological cancers. So that was the end of my little bit. I'll stop sharing now, and I went only a little over by a couple of minutes. Thanks so much for listening to me, folks.
Thanks so much, Allison and Leslie. Okay, so we'll now move on to our question period. So for those of you folks watching, there is a question box at the bottom of your screen. So as we go through, if you have any questions, feel free to type it into the chat and we'll try to answer it right now. So I'll read through some that we've gotten already. The first here is for Leslie. If I have a Pap test, would I be able to bring a family member or a friend with me to my test?
The answer is usually yes. Every clinic has a different policy around other people attending the clinic appointment, but in most cases, yes, it's a non-issue to bring a friend. It would be fine. If it's for interpreter purposes, it's better to make a request for an interpreter. That can be supplied for you, but if it's just for supportive reasons, for sure. Yeah, I don't see it being an issue. You just want to mention it when you make the appointment, just to give the clinic a heads up. Good
Great.
question.
Question number 2 here.
Sure. Can I say one more thing about that?
Yes, go ahead.
Just on that note, for pap tests, you can do that. And I'd also like to just let you know that for breast check, we actually do group trips. So if you want to come and get a mammogram with some of your friends, you can do that as a group together. You can make like a group appointment. So that's just something we'd connect you with the right people here at Breast Check to do that. But I just want to let you know. So if you are feeling a little anxious about it, you can come with a friend or a couple friends. Okay.
That's great. Our next question here is, can I request a colonoscopy to be done before age 50?
So in Manitoba, colonoscopies are used for specific reasons. So it would depend on what the reasons were. So best thing to do there is to talk to your healthcare provider and explain why you think you need a colonoscopy and ask them if they agree. And if they do, then they would potentially make a referral for you. But in the colon check, we only screen people age 50 to 74.
Perfect. Perfect. The next question here is, what would be the address to send my colon test to?
So in your kit, okay, so I should clarify, you can get a kit from a healthcare provider and it may not be a colon check kit. It might be a different kind of kit. So, but on our kits, right on the front of the envelope is the address. So it literally, you just put your kit inside with your reply form, you seal it shut, and you literally just pop it into the mailbox. It's as simple as that. The address should be on there already.
Okay, and the next question is also related to colon test. So can I take my colon test to the closest lab?
Best thing to do is for a colon check kit, you would just pop it into the mail. So there are other kits out there. So best thing to do is to follow whatever the instructions say inside of the kit. But for the colon check ones, you just have to pop it into a mailbox. They are only processed at one particular lab in the province. So that's why the mailbox is really the best route for that.
Okay, and the next question here is, can an adult get the HPV vaccine now if the person is an immigrant and not sure if she has ever received the vaccine in the past?
There's a lot of questions in that question. So there is an eligibility criteria that I mentioned for females being born on or after January 1st, 1997, and males born on or after January 1st, 2002. However, if people are born before that, they can certainly get the vaccine. They would just need to pay for it. There is also a specific group, a listing of different types of situations where somebody might be at higher risk for an HPV infection. And I put the link right into the answer there so you could see exactly what the list says. And then you would be able to have the vaccine covered by Manitoba Health. So it's kind of a long and complicated answer. The best thing to do is to talk to your healthcare provider, and they will help you figure out where you fit in terms of if it's covered or not covered and how you should access it. So healthcare providers are great resources for that stuff.
That's great. Thanks, Leslie. And the next question here is for Allison. Can Allison give some examples of barriers that navigators can assist with?
Yes, definitely. So that's a really good question. And I think that it can be very broad. So we can think about it more around the needs of an individual. And we've talked a little bit about things like interpreters. So one barrier that might come up is somebody's having a hard time accessing the information that they need because they may not have had an interpreter with them at an appointment. So navigators can help support ensuring that interpreters will be at the appointments at Cancer Care Manitoba or at other appointments. As well, they can help to advocate for interpreters over the phone if necessary, and can review information with an interpreter over the phone if somebody does require going over that information again. Another barrier may be practical. So psychosocial oncology clinicians or the social workers who are working with the cancer navigation services might be able to help figure out how to set up transportation if folks don't have access to their own transportation to and from appointments. Other examples could be getting folks set up with financial assistance if they don't have income. And that can again be done through the support of the social worker, psychosocial oncology clinician. The nurse navigators can also help with information sharing between providers. So trying to set up a bit of a circle of care around somebody who is going through the cancer journey, so that folks in the community, let's say their primary care provider, or if they're connected to home care, or if they have a support worker who works with a specific program, if they can really help to advocate for everybody to talk to each other, and that information sharing, so that somebody feels that they're getting kind of the optimal care that they need. So those are some examples. Bigger barriers where I might get involved are issues around coverage. So if somebody doesn't have coverage for medication, as an example, and that becomes a barrier to accessing care, or and other issues may be that they don't have access to telephones, or maybe even housing, in which case we need to work with as many programs or supports as possible, or the right supports, to try and ensure that people can be in safe spaces so that we can begin care or treatment for cancer.
Thanks, Allison. And we have another question in the chat here. Why are the several screening guidelines up to 74 years old? What happens to older fellows?
That's a great question. I like the way you worded it too. So whenever we use a screening test, like the FOBT kit, for example, or the PAP test, we target a specific population group of a certain age to maximize the benefit of the test and to minimize the potential harm. So something that Allison talked about a little bit was sometimes somebody may have a cancer in their body, but it's so slow growing that 10, 20 years down the road, they still have that cancer, but they're actually dealing with another health issue that is even more life-threatening. So it's a similar situation when somebody is over the particular targeted age, is they have other health issues potentially that are competing more for being addressed than the particular cancer screening test. And there's potential harms with some of the cancer screening tests. They're not risk-free tests. So sometimes when somebody gets older, it's just not the best test for them anymore. So it's kind of a complicated answer because it depends on the individual person, but that's a very general answer that hopefully gives you a sense of why.
Thanks, Leslie.
I just wanted to make a quick note, and it's moving the conversation a little bit away, but we have a question that came up that had some specific information about somebody's own experience. And I think this is a good example of when to seek advice from a healthcare provider who can do an in-person assessment and really get at that history and physical. Whereas, when we're talking about things generally, it's hard to get at those specifics. So really trying to determine about high risk, there's a couple of options. Leslie had talked about, if it's related to a screening test, doing that quiz around whether you should be screened, or if you may be increased risk. as well, talking to your own healthcare provider directly is such an important thing to do to get a sense of your own risk, because there's so many specific things that can be related to increasing your personal risk of cancer. So that would be kind of the best, I think, advice to anyone who's seeking information about their own personal increased risk of cancer.
Thanks, Allison. And we have one more question here. When I'm done with my colon test, is the envelope to mail it in prepaid?
Yes, you don't need to add any postage. We pay for that part. Yeah, just pop it in the mail. You're good to go.
Awesome. And that is all of the questions I believe we have. And if there are any other further questions, I will be sending out an email following our session, and you're welcome to direct any questions to that email and we can get that sorted out for you. And now I'd like to invite Dr. Tunji Fatoy to deliver some closing remarks.
Yes, thank you to Leslie and Allison for their presentations, but I wanted to thank all the participants who joined us this evening to talk about cancer screening. I really appreciate all the questions that people brought forward, and also echo Allison's thoughts that if there's specific questions, seek advice from a healthcare provider. But as we go on, I also want to take this opportunity to invite you all to look at another opportunity that we have coming up on November 25th and 26th. It's a patient and family conference, and Melanie's put that up. It is our first ever patient and family conference, and it's about living with cancer. Keynote speaker on Friday is Catherine Rayford, who is a cancer warrior, a performer, a motivational speaker. She's a stretch expert, and she's the current title holder of the Amazing Race Canada. So the speech is titled, a keynote titled, Cancer Dancer, How to Overcome What You Think is Impossible. This is going to be on the user-friendly platform Meet. It is free to register, and the registration details, as you can see there, you can scan the QR code on the screen, or for those who participated today, we can also send you the link to register. And please do not hesitate to share this link with people in your lives, family members, friends, acquaintances, co-workers, whoever it may be. This conference is not limited to new immigrants. This is for everyone who is either a patient and or has a family member or friend that has been touched by cancer. So once again, I thank you very much. If you have any other questions about this, I think that you can reach out to the organizers of this evening, and if there's any way we can help you out by directing you to the appropriate places, we will do that. Thank you.